Hmm.
Hi Andy, this is Dr. P. Ravikiran, General Physician and Diabetologist at Owners Robotics Hospital, Champapet. As a diabetes and general physician specialist, as a part of corporate social responsibility, we have been taking the process of educating our viewers and our customers so that they can lead a healthy and better life by following the science behind the diseases. When we know more about the diseases, we can control it better. So let's discuss about the role of belly fat and visceral fat in diabetes and metabolic diseases, and why is it of utmost importance in our Indian population, because our Indian patients are thin, obese people who are thin in their limbs and have obesity and visceral fat in their abdomen. So this makes a perfect combination for disaster. Let's discuss how it's affecting our health in detail. Many Indians develop diabetes without looking obese. మెనీ టైమ్స్ చాలా వరకు మేము ఓపీలో ఏం చూస్తుంటామంటే పేషెంట్స్ సన్నగా ఉంటారు కానీ డయాబెటీస్ డెవలప్ అవుతుంటారు. వాళ్ళే దే ఆర్ కన్సర్న్ దట్ వాళ్ళు సన్నగా ఉన్నా కానీ వాళ్ళకి డయాబెటీస్ ఎందుకు వచ్చిన కన్సర్న్ వాళ్ళకు ఉంటుంది. సో చాలా మంది తెలియదు ఏంటంటే మీ బరువు కన్నా కూడా మీ వెయిస్ట్ సర్కంఫరెన్స్ అనేది చాలా ఇంపార్టెంట్. ఎందుకంటే నడుము దగ్గర ఏదైతే ఫ్యాట్ ఉంటుందో ఆ ఫ్యాట్ అనేది చాలా అన్హెల్తీ ఫ్యాట్ విచ్ విల్ ప్రొడ్యూస్ టాక్సిన్స్ ఇన్ టు ద బాడీ, కాజింగ్ అస్ డయాబెటీస్, హైపర్ టెన్షన్ అండ్ అదర్ డిజార్డర్స్. సో ఎప్పుడైతే మన వేస్ట్ సర్కంఫరెన్స్ అనేది ఎక్కువ ఉంటుందో, పెద్దగా ఉంటుందో, then that would cause us a lot of problems. So size is often more dangerous than body weight. Today we will understand what belly fat means, why visceral fat is harmful, how it leads to diabetes, BP, heart disease, and most importantly, how to reduce it scientifically. What is belly fat? In body, there are two types of fats. One is subcutaneous fat, the other is visceral fat. Always remember, the subcutaneous fat is the fat around under the skin. You can pinch it, less dangerous, mainly a cosmetic issue. So the main thing with subcutaneous fat is the fat present around our skin, which can pinch it, it's less dangerous and it's mainly a cosmetic issue. Whereas the visceral fat is a dangerous fat. Not all belly fat is the same. Visceral fat is the real villain. It is the fat stored deep inside, especially around our vital organs like liver, pancreas, and intestines. So it cannot be pinched. Highly active hormonally, major cause of diabetes, insulin resistance, and heart disease. So the visceral fat, which is the fat wrapped around our intestines, our liver, or pancreas, this is the most dangerous type of fat because it releases harmful chemicals into the body, which causes all these major problems. Inflammatory cytokines are produced by the visceral fat. Why visceral fat is so dangerous? Visceral fat behaves like a toxic endocrine organ. It releases inflammatory chemicals like inflammatory cytokines, free fatty acid, stress hormones. The effects on the body are blocks insulin release or insulin action, leads to insulin resistance, increases liver fat called as fatty liver, raises blood sugar, raises blood pressure, and worsens cholesterol. This is why lean looking individuals get diabetes, sugar rises even with less eating. The main cause the Indians are having diabetes is secondary to the visceral fat. Visceral fat and insulin resistance connection. How the visceral chain reaction happens. Excess visceral fat leads to inflammation, inflammatory cytokines, inflammation around the liver and muscles. Insulin cannot work properly. Pancreas produces more insulin. Eventually, pancreas gets dried out and gets exhausted. Later, type 2 diabetes develops. So, visceral fat is the root driver of insulin resistance, which is the root cause for all the majority of the infection of the problems the humans are facing now. Why individuals accumulate more visceral fat? Genetic factors. Thin fat Indian phenotype, where the person is thin at the limbs and the legs and has the fat around the abdomen. Lower muscle mass, higher body fat at lower BMI. Lifestyle factors like highly refined carbohydrates like rice, wheat, and sugar. Low protein intake. Apart from this one, the lifestyle changes which include sedentary lifestyle, long sitting hours, poor sleep and stress management. These result in normal BMI, high waist circumference, early diabetes and heart disease. Warning signs of excess visceral fat. Even without obesity, look for waist size increasing, tight pants at waist, fatty liver in scans, high triglycerides, low LDL cholesterol, HDL cholesterol, high fasting insulin, pre-diabetes or diabetes, and rise in BP. Always remember, if the pant is loose in your limbs and tight at your abdomen, it means that you have an increased waist circumference, which is of utmost danger. Waist matters more than weight. Always remember. How to measure risk clinically. Waist circumference for men, if it is more than 90 centimeters, and if it's for women is more than 80 centimeters, the patient is at high risk. Waist to height ratio greater than 0.5. For us, the waist should be less than the height ratio by more than less than 0.5. Lab indicators like fasting glucose, HbA1c, triglycerides, fasting insulin, and HOMA-IR. HOMA insulin resistance marker. These are used to assess the risk clinically. Can visceral fat be reduced? It's a definite and big yes. There are scientifically proven strategies which include diet correction, physical activity, sleep and stress control, and medical supervision, which can improve the visceral fat. The first important thing is diet control. Reduce refined carbs and sugars. Control your portions, control your calories, increase protein, increase fiber, and time restriction eating when suitable. Make sure that you are following low calorie, high fiber, high protein, intermittent diet where the calories are restricted and there is a post meal walking. Physical activity, brisk walking, resistance training, core strengthening, reduce sitting time. This is one of the most important thing. Reduce your sitting time. Whenever you get a possibility, start a walk. Take a light walk, a slow walk to move your muscles to utilize glucose. It is one of the most important thing. Stress and sleep control. Poor sleep increases belly fat hormones. Follow sleep hygiene techniques to get a good sleep. Stress raises cortisol, which increases belly stored fat storage. So control your cortisol, control your get a good sleep to prevent complications. Medical supervision. When all of these four things are done at a full potential, and even if there is no control, then there is a role for medications, not prior to that one. Identify insulin resistance early, individualized plans, not crash dieting. The myths to bust. Only obese people get diabetes. Doing abs reduce belly fat. Skipping meals melts fat. Medicines alone can fix it. These all are myths. Always remember the thin people also can get diabetes. Doing abs only for a short duration is not going to help us. Sustained, disciplined diet and lifestyle are needed to control diabetes. Skipping meals leads to low basal metabolic rate, which in turn leads to weight gain whenever we consume even at normal quantities also. Medicines alone can never fix it. Medicines are just a part. Even without medications, we can fix our problems by doing proper diet and lifestyle changes. Belly fat reality. Belly fat reduction needs metabolic correction, not shortcuts. Key take home messages. Belly fat is not just a cosmetic issue, but it's also a life-threatening condition. Visceral fat is equal to metabolic danger. That's the root cause of insulin resistance, and Indians are more genetically vulnerable for that one. Early action can prevent or reverse diabetes. Scientific lifestyle correction always work. Science follows, the human body improves. Don't wait for sugar to rise before acting. Get your waist, sugar, and insulin resistance checked. Early correction can prevent lifelong diabetes. Follow us for more evidence-based diabetes reversal guide. We at Onus Robotics Hospital can guide you attain diabetes reversal and can help you lead a happy and sustainable life without any much need for medications and without any need for medications. Thank you.